Welcome back to Reading Between the Lines with Tandaman. This is episode 9, and I have someone very special with me from Baltimore. His name is Dr. Tim Witham. He's a professor of neurosurgery from Johns Hopkins University. It's great to have you here, Dr. Witham.
Thank you very much, Tan.
Absolutely. Dr. Witham doesn't need an introduction. You can Google him and you'll find out who he is. But because we have him here with us, Dr. Witham, why don't you give us a brief introduction about yourself?
Sure, thank you. My name is Tim Witham. I am a professor of neurosurgery at Johns Hopkins University, where I work in the neurosurgery department, specializing in spinal surgery and the treatment of disorders of the spine, primarily degenerative conditions, spinal deformities, and some spinal tumor work as well. And I've been fortunate enough to have been one of the first surgeons to work with augmented reality as it applies to spinal surgery.
Absolutely. So, Dr. Witham, talk to me about your background. How we know today where you are, but how does the journey of Dr. Witham comes to the point where today you're sitting at the position that you are? Why did you choose medicine? How did you come up to the point to choose medicine, but also neuroscience in particular?
Yeah, so it is a long journey, and that is something that I would emphasize about it. It's it's a marathon, it's not a sprint. But for example, in the United States, it requires 4 years of college, which I uh, attended Penn State University and got interested in the biological sciences and interested in the concept of going into medicine and initially, trying to help people. So then I spent 4 years in medical school here at Johns Hopkins. And while I was there, I became interested in the field of neurosurgery. It was really fascinating to me, the neurosciences, watching surgeons operate primarily on the brain is where I got my initial interest. And it was the people that turned me on to this field, and they were incredibly gifted, incredibly good teachers, and excited about their work. And so I became interested in the field of neurosurgery and specifically brain tumors. Spent some time doing research in brain tumors. And then I continued my neurosurgical training at the University of Pittsburgh, Pennsylvania, and that's a 7-year training program. So, 4 years of college, 4 years of medical school, 7 years of training. And then at that point, you're sort of licensed to go out and start to practice on your own in neurosurgery. And I, at that time, had an obligation to the United States Air Force because they paid for my medical school.
Thank
I
you for your
then,
service.
oh, you're welcome. Yes. And I spent 4 years in the Air Force as a neurosurgeon, taking care of soldiers and their families and retirees in Mississippi. And then after that 4 years, I sort of began to realize that spinal conditions are very common, and not only in the military, but in the general population. So I became interested in spinal disease and did advanced training in that here at Johns Hopkins, where I did a fellowship. I was fortunate enough to stay on the faculty here after that.
Absolutely. So let me ask you this question, and this would relate a little bit from your work with the U.S. Air Force, right? You said that spinal injury is very common. What are the main causes of this spinal injury, especially when it relates to serving members in the Air Force or the Army?
Yeah, yeah, no, great question. So, yeah, and it's not even spinal injury. Spinal injuries are common, and so yes, trauma and accidents and things like that. There are many people affected by that, but if you think about the spine is, if you will, if you think of the human body as, let's say, a large office building, the spine is the scaffold. It's really what, the structure that holds up that building. That's how we stand, and the bony structure of the spine supports our bodies. And So what has happened over time is that doctors in other fields, cardiologists and lung doctors and GI doctors, they're able to treat chronic diseases that keep us alive longer. And so what happens is, as the population ages and people are living longer, it's that scaffold that then starts to break down. And so all of us develop wear and tear changes in our spine, in our joints. And the spine is a complex series of joints. It's the most complex set of joints in the body. And so those joints, which include discs and something called facet joints, they all can wear out over time. And so what we call degenerative disease of the spine is extremely common, and it becomes even more and more common as our population ages. But there are other conditions that also affect the spine, but that's the most common degenerative spinal disease, and that's what we end up taking care of the most.
Right. And we, as as uh, as we see a lot of people um, working more and more on computers, it's often been said that going forwards, the human posture is gonna have more of a hunchback sort of um, outlook in the next few generations. Do you see that as a concern from where you're sitting at right now?
Yeah, absolutely. And that's a great point. We see a lot of, so this that hunched posture, we call that, the medical term for that is kyphosis. And all of us as we age, we start to kyphose, we start to bend forward. And I think that you're absolutely right that the technology contributes to this problem. We see kids these days constantly on devices, constantly on their phones, and they're leaning forward like this and looking down at either an iPad screen or a phone screen or maybe a computer. And I tell my patients all the time that work on computers for a living, make sure you try to get a level environment where ergonomically you're more upright. Um, but yeah, so that kyphosis leads to deformities of the spine and that hunching forward, and we do spend a lot of time nowadays taking care of patients that have those problems, and sometimes that requires surgical intervention to treat that type of hunchback or deformity.
Absolutely. So as we're looking at specializing in your field, especially when you're looking at neurosurgery and spine in specific, right? Um, how do you think Web3 or AR technology, including and other technologies, how do you think they can sort of aid in not only pre uh, pre disease conditions, but even post care? How do you think that can sort of aid in that aspect?
Yeah, well, that's a complicated question, and I guess I can answer it maybe in some parts. But basically, right now, I would say the trend in surgery and the trend in medicine is, we would love to be able to treat, in this case, obviously, spinal disease or spinal disorders as minimally invasive as possible. We want to do it as efficiently as possible. Um, and as effectively as possible for patients. Um, and so what that means is obviously we want to do things better than we did them, several years ago. And so technology plays a role in that. And the idea is to make, let's say, spinal surgery, spinal procedures faster, more efficient, safer. And in doing so, we try to bring different technologies into the picture. And so a lot of folks have heard about robotics as it relates to surgical procedures. And there are a number of examples of robotic surgery in medicine, including spine surgery. And that is a major advance in the technology and what we do. And right now, for example, robotics allow us to place spinal instrumentation more efficiently and more accurately. But I think what happens is I don't know that we can completely automate things. There are things that come up on the fly, if you will, while you're operating and while you're trying to treat a biological system, variables that a robot cannot react to.
Right.
And so the way I see, or the way I envision augmented reality in surgery, is that you have this combination of technology, advanced imaging, that allows you to have a technology assisted component to the surgery, but then also the human component is maintained, that is much more adaptable. Humans can react on the fly. We can change the plan based on variables that are presented to us in real time that I don't think robots can do. And so that's where I think the augmented reality comes in. And the augmented reality combines the surgeon's view of the real world right now, but there are computer overlays, augmented images that come through the technology that are used for us. They assist us in performing the surgeries.
Absolutely. So let me bring out the main question that I think all of our viewers would have. Since you are a professor of neurosurgery, I have to put this question to you. Elon Musk wants to create a neural link, which is essentially a brain chip interface, right? Where he wants to put a chip in your brain, so we can have superhuman cognition technology and things like that. Do you think that is a reality, or do you think that is um, just wishful thinking?
Um, yeah, I mean, I think if you fast forward into the future, I think it's probably reality. But along with that type of um, idea or concept, there's going to have to be a lot of sort of ethical debating and planning, and where do we sort of draw the line with these types of things. And that's one of the things that comes about when people think about cloning and building a human from genetic technology or whatever, and trying to clone someone or something like that. It creates ethical dilemmas that also have to sort of regulate or parallel the development of these sort of what maybe seem like far-fetched ideas right now, that could be reality, but may create other problems. And so that's what has to be considered when you're developing that type of technology, considering it.
Absolutely. Also, as we look at we think about this whole Neuralink thing, right? Every time you do something invasive, especially when you do it at the brain, we all know that it changes your personality as a person, right? It changes something every time you put something in or take something out of the brain. You're not the same person as you went into the surgery. So from that perspective, do you think it would play an impact, or do you think that even if this was possible, it would be more of a non-invasive sort of technology, or do you think we would still this would still develop into a technology that a chip goes into your brain physically?
I think it probably wouldn't be that hard technically to do it. I'm not sure that I know how you would hook the chip up so that it links to, let's say, all the areas of the brain. That may be a little bit complicated. It's a little bit out of my sort of field of expertise, but I think that, to your point, I think that there would be plenty of people that would sort of volunteer to do it, if you will. I personally would not be one of them, but I think people would volunteer, and then they would have to be carefully sort of studied. And most of these types of things in the scientific world, the things get regulated, and a lot of times, for example, in the United States, the FDA requires, in many cases, preclinical studies, meaning, okay, before you put a device like that in a human, it would probably have to be placed, in an animal in a controlled research environment to study exactly what you're looking at. So, yeah, it's a little bit far-fetched, but it would probably take years to study it and develop it before it would actually happen.
Absolutely. If you like the video, please hit the like button. If you think what's being discussed is nice and you'd like to join the discussion, please comment below. And if you'd like to stay updated, please subscribe to our channel and hit the bell icon. Thank you. So as you think of neurosurgery from an angle of an expert, um, do you think, and this is more of a me trying to dig your brain, but do you think brain control is real? Because we see a lot of times, and I'm sure a lot of our viewers have noticed this as well. Now there's this thing that you were speaking something and Facebook would show you the ads. But there is more and more research that a lot of big tech companies have sort of figured out a way either to map their cues to your brain or your brain's cues to the products that you want to buy. So do you think um, that brain control is here?
Well, I mean, I think that you're obviously on to the point that, marketing research and I'm sure, big companies bring in people who are psychological experts, and obviously they are able to influence decisions and have very persuasive ways or techniques for getting humans to do things. I mean, I guess I would hope that in the future it's not going to move into an area where, we're totally controlling exactly what someone is doing. I guess it would be this concept of brainwashing, if you will. It's a scary thought. I hope that it wouldn't be, at some point it wouldn't be allowed, or the regulation would keep it from happening. But I think you're right. I mean, I think it would be more than just. There would have to be some kind of link to the brain, and maybe that could be done non-invasively, and that's a scary thought, because let's say you could send some type of cell phone wave or Wi-Fi wave into somebody's brain, which may be possible, that would actually make them do something. That is a very scary thought, but
Is that possible?
I think someday it would be possible. Right
I mean,
now, I don't know
theoretically,
that.
it's possible, right?
Yeah, I think so. But I don't know that, obviously we're not at that point. But right now, we're just influencing people through, others' thoughts and words and actions and visions. But yeah, maybe there could someday be a technology that could send, some type of signal, electronically generated signal, into someone's brain to have it affect the way that person, does something, reacts to something. I think it's possible. It's a scary thought.
How do you block that? If that does exist in a hypothetical future,
Well,
how
I
do
mean,
you
I
block
think,
that?
I think it's like, it's like cybersecurity or um, it's like when people invade your computer. If you think of the brain as a supercomputer, I think that, we have all of these malware devices on our computer and things like that to try to keep people from stealing information inside of our computers. And my guess is it would move to something like that, where there would be technologies if there was a warfare, so to speak, between somebody trying to influence other people, you would have to develop a defense mechanism for it. And I think that would be possible too. But again, it could get pretty ugly.
Absolutely. I think, and this is me just throwing my thoughts. I think what you have described, if someone was to exploit the this technology, I think that would be for elections. And we've seen all sorts of technologies being exploited for advantages in elections. So I think this, if it was to exist, we would see that being being used for elections.
Yeah, yeah. I think it probably could be. Sure, absolutely. Um, yeah, you would hope that people would use it to make things better and to to do good in the world, if you will. But like many technologies, they can be abused.
Absolutely. All right, let's move forward to what you have done some work with Augmetics, an Israeli company. Why don't you tell us about that, Dr. Witham?
Yeah, sure. So Augmetics started as an Israeli company, but now they are based out of the U.S. They developed a augmented reality headset based on fighter pilot technology, and it was specifically developed for the placement of spinal instrumentation, which is a common procedure that we do in the spine. And we place implants in the spine to stabilize the spine. So we talked about how the spine is the major scaffold of the body, and when it breaks down, often it needs to be stabilized or reinforced, if you will. And currently the way we do that is by placing rods and screws into the spine to stabilize it and perform spinal fusion, which means we try to join uh, a series of one or two vertebrae together or a series of vertebrae together. And one of the issues with placing those implants is sometimes we can put them where they're not supposed to be. We can put them outside of the bone, and the spinal cord and the nerve roots are just millimeters away from where we're placing the instrumentation. There are a number of techniques that we can use to do it. But again, this device was developed to improve or increase the accuracy and confidence of doing that. And I had the opportunity to do the first procedure here in the United States where we successfully placed spinal instrumentation into one of my patients in June of 2020. And that was the first case, and we've subsequently done, I personally have done close to 150 cases, but in the United States now, this device has been used with augmented reality now for greater than 2,500 cases. So it is something that compares very favorably to any technique for placing spinal instrumentation, including robotic surgery. But it's still an evolution. It's something that we need to make better. It does come at a cost. We have to take some time during the surgery to do a CAT scan and image the patient's spine, and there's something called a registration portion of the procedure. And so it's not quite as fast maybe as other ways of doing it. And so we're working on the efficiency and improving the technology.
Right. Let me ask you specifically on a few numbers then. Does this technology help have a faster recovery as compared to traditional methods of surgery? What's the difference that you see yourself with it?
Yeah, so right now the idea is that it allows us to place instrumentation more accurately. So that there aren't complications from that. So that, we don't put a screw into, like I said, the spinal cord or a nerve root and cause an injury to the patient, or create a situation where the patient requires an additional surgery to come back and revise misplaced spinal instrumentation. And so the idea is that it makes it safer and hopefully easier for the surgeon to do it. So better for the patient, easier for the surgeon. Now, that in and of itself is probably not enough to really justify the technology. We have to advance this field and be able to do other things that really make it more relevant, helping us remove spinal tumors, helping us to correct deformities like we had talked about earlier in the interview, kyphotic deformities, people hunching forward. That requires cutting the bone in specific areas and changing the alignment of the spine. And if this technology could help us do that more easily and more with more safety, then we're going to really start to be able to justify its use, move the field forward, improve the efficiency of surgeries, make it safer, faster. And then, yes, then it will spill over into, if your surgery is safer, faster, patients should recover faster as well. We're not there yet. We're not there yet. We're
Right.
still, in an early stage to develop these things.
Right. Let me sort of then question this from another angle. Me, who's not an expert, you said that these AR headsets superimpose CT scans, right? Could it then be possible in and extrapolating this technology a little bit that you do the entire body scan, and where we would essentially do a normal surgery, let's say a heart surgery or anything else, before you even do that, you can map the entire body as it is right now. And then, if, for instance, you see that there is some issues in the liver as well, while you're going to open the heart, you can do that without being invasive, but know of that issue beforehand because you have this technology at hand. And then you can map the entire human body of the patient.
Yeah, I mean, I think you're you're getting a few steps ahead, but I think that's maybe where it's going. Uh, People are talking about, an augmented reality eco environment where you're looking at everything inside of the human body, kind of all at once, and yeah, being able to map out every organ, every part of the body. We're not there yet, but um, that's potentially where it's going.
We have to be hopeful because that's
That's
that.
right.
And end of the day, the technology exists to make everyone's life better. So yeah, I mean, developers, if you're looking at this interview, what are you doing, right? If you like the video, please hit the like button. If you think what's being discussed is nice and you'd like to join the discussion, please comment below. And if you'd like to stay updated, please subscribe to our channel and hit the bell icon. Thank you. Apart from that, as this technology stands, um, do you think this can, and this is how it helps you as a surgeon, right? But how can this technology help the patient in aftercare? And is there any aspects that you see straight away that can help the patient in the aftercare?
Well, I think there are kind of two components to that. One is that if the surgery is performed more safely and faster, than the recovery, we touched on that, could be better. But I think that there's also another kind of angle to this, and that is it's not so much the augmented reality technology itself, but it's other technologies like artificial intelligence, and people are using that now to track patients after surgery, to see what it is they're doing and to learn about, maybe people are doing things that they shouldn't be doing after surgery, and we're learning about things that people are doing when they're having more pain, or maybe they're not exercising enough. So there are Fitbits and things like that are tracking patient activity, and that's giving us more data on the aftercare component to surgeries, and what we can take that data and decide what works and what doesn't work. And then we can learn and make recommendations to patients based on that. So it's not necessarily the AR that does the surgery, but it's the use of some other technologies that are maybe part of the metaverse, if you will, and that will improve aftercare as well. So it's a different angle of looking at it. But, yeah.
Absolutely. And that is a great point to end on, because that brings me to my next question, which I wanted to ask you. What do you think, from your uh, from your angle, is the future of metaverse in medicine, and how can metaverse help in medicine?
Yeah, I mean, I think that there's going to be sort of there may be kind of two components to that. The big push nowadays is this concept of something called personalized medicine, and which means sort of individualizing someone's care, and not everyone is different, right? No, no two people are the same, and so the standard way of practicing medicine is that we base our decisions based on large studies where we studied a number of patients, and we come up with conclusions from these studies. But then the question becomes, okay, can we take this large study that was done, let's say, on some medication that we tried, and this medication worked very well in this large group of patients. Does that mean that it's going to work well in our specific person we have in the office at that time? And the answer is maybe it doesn't, because there were probably some people in that large study where that medication didn't help. And so the technology is moving in a direction where, yeah, we're going to have, like you had mentioned, we're going to have these full body scans, and we're going to have, blood samples are going to give us not only, what is the value of the patient's, sodium in their bloodstream, but it's going to analyze their DNA. It's going to analyze their genetic makeup. And then we're going to be able to make decisions based on much more specific data that is, comes from technology that spits these things out of a computer and will dictate what treatment the patient needs based on their own individualized data. So that's where metaverse technologies are going on the one hand. And then I think on the treatment side, I think that we're going to move toward basically virtually non-invasive procedures. Are there going to be ultrasound waves, or different forms of radiation or whatnot, or ways to do surgery without an incisionless surgery? There are examples of that already for treatment of certain tumors and things like that. We have you know, things called radiosurgery, and that would be an example of a way you could treat a tumor through, focused radiation. But it's going to get even more advanced than that. It's going to come through the technology, which will involve imaging. So yeah, I think it's exciting.
Absolutely. As we look at the field of neurosurgery, but medicine in terms of metaverse, right? Um, Education is an obvious aspect that comes to mind, right? Because someone, let's say, in rural part of Bangladesh or parts of Africa or India or any other developing and frontier markets, now they can potentially have um, access to the same tools as Dr. Witham can, right? And potentially they can be your students online. Um,
That's
do
true.
you do you see metaverse and Web3 per se sort of playing a role in educating the next generation of neurosurgeons and medical professionals?
100%. I mean, you kind of hit the nail. That this is where virtual reality comes into play, which is a little different than augmented reality. Virtual reality means it's not really it's not a real, there's not a component of the real world in it. It's a virtual world. But through virtual worlds is where things are going with teaching and training. And so we're able to have simulations now that sure would allow someone in an austere part of Africa to practice doing surgeries, and the simulators are getting better and better at it. And then similarly, as you mentioned, I could have access to that surgeon's operating room through technology while they're doing their surgery, and perhaps even being able to point things out while they're in real time doing the surgery, or vice versa. They might have access to my operating room while I'm doing a procedure and can learn without actually being there. So yeah, the world is already moving in that direction, and the virtual reality and virtual world, as well as complex video linkage and audio video linkage to someone else's operating room, is also now becoming a reality.
Absolutely. Do you feel that the access to technology is fairly distributed amongst, let's say, developing countries, or do you think there should be more, as Sam Altman would say with OpenAI, there should be more um, open innovation rather than locking things within patents and trying to say that, oh, just
Yeah,
because we did it, it can only be done in this country. But then if you have that as an open source, especially in the medical field, someone could replicate and create that technology for a cheaper um,
yeah. I
price.
mean, these are questions that are sort of it's a deeply philosophical, I guess, political question. And I would say, unfortunately, so these technologies unfortunately follow the money, right? And so a country like the United States, which is a wealthy country, is, I guess, unfortunately at this time, going to have more access to these types of technologies, and then they also have money to try to develop these types of technologies. So yeah, I mean, I think it is a philosophical question that yeah, we'd like to have everyone have the same access to all of these things in every country. But I
Absolutely.
mean, you could say the same thing about agricultural techniques to be able to develop food sources for third world countries and things like that. Same is
Yep.
true, in that area. So it's a big problem.
Absolutely.
I don't know the answer to it, but
Absolutely.
unfortunately, right now these things follow the money.
Yeah. So that brings me to my next question. We've been talking in a very positive light of the AR and VR technology, right? And we love to be optimists. I'm an optimist at heart, but I'm also a realist. So let me keep it level, and ask you this question. What do you think are a few drawbacks of AR and VR technology in the field of medicine?
Yeah, well, so for example, in my field in spinal surgery right now, there are a lot of surgeons that are very reluctant to adopt the technology because, I would say that, for example, the research I'm doing, I haven't been able to prove yet that let's say it's faster. I can do it more accurate, as accurately as any other um, technique, but it does come at a little bit of a cost of the surgery being a little bit longer. We have to take a little more time to get the AR set up and to use it. And there's a learning curve when somebody adopts the technology for themselves. And so, that's a drawback for a lot of people. People would say, oh, well, I can do it pretty well with another technique, with just using an X-ray or doing it something called freehand instrumentation placement in the spine, where people just do it basically without any kind of image guidance. And a lot of surgeons do really well with that. And they're faster. And so, yeah, there are obstacles, there are hurdles, there are developments, things that need to be overcome that um, we're going to evolve over time before these technologies become universal. And then the cost, the cost. We touched on that too. I mean, these things get developed by companies that have commercial interests, and so there's a cost associated with it.
Absolutely. Um, so these are all um, very factual information. I wanted to talk about you personally. Uh, when you're doing surgery using this AR technology and potentially metaverse as well, how do you feel? How do you personally feel about doing using these technologies when you're performing surgery?
Yeah, so I mean, I think that it's kind of cool. You think you're kind of like in space age. You're wearing these headsets, and one of my colleagues calls it the spaceship. Um, the technology, the headset's a little bulky right now. It's going to turn into glasses. They're going to be AR glasses that we use, and that's going to be even better. But I didn't grow up in the generation of what we call the gamers now. But it's like playing a little computer game. And the one thing I notice is that my trainees, our residents in training, they pick it up very rapidly. They're very facile at it. And I think that comes from the generation of students who are sort of facile with these gaming, computer games and things, and that's a little bit what it feels like. Is that you're sort of playing a little computer game, and it's kind of, yeah, you have a kind of a more powerful feeling when you're doing it.
Absolutely. Um, So let me ask you another question. What other areas in medicine, apart from say surgery or training new students, do you think Metaverse and Web3 can help in the medicine field?
Yeah, I mean that's a harder question for me since I am pretty highly specialized. But like I said before, I think this area of personalized medicine um, is going to be such that with just you know I think at some point going to the doctor is going to be you know You get your body scan, you draw a sample of blood. These things get analyzed by some type of computer system. Um, they'll be able to look at all kinds of genetic diseases that you're predisposed to, and it's probably going to be more of a preventive medicine approach in the future. So, for example, in spine, I think what will happen is when the cost of these scans comes down, everyone will get one. Yeah. So in the future, I think these body scans and things will become more available. And I think that what will happen is, for example, in my area, the imaging that'll be done of the spine will be done in patients who, let's say, have a predisposition to spine disease and, let's say, degeneration of the discs or something like that. And maybe their genetic background shows that. And so those patients will then, let's say, get some type of injection into their discs, and those injections will preserve the discs and prevent them from wearing out before it even requires a surgeon to get involved. And so I think the metaverse is really going to take off in the area of preventive medicine. And how do we prevent people from getting certain diseases? Right. Same thing will be, I think, with cancer. There'll be genetic testing, and there'll be markers in the bloodstream that either show very early cancer or or a predisposition to it, and there'll be a way to prevent it from happening. And that's going to be huge. I mean, we're not there yet, but someday I think that's what's going to happen.
Right. If you like the video, please hit the like button. If you think what's being discussed is nice and you'd like to join the discussion, please comment below. And if you'd like to stay updated, please subscribe to our channel and hit the bell icon. Thank you. Let me ask you this question then. If let's presume not everyone, but a lot of people's hyper-personalized data and their markers are there, right? And we all know that a lot of ransomware has been there, right? If someone does get their hands on this data, and I'm not going to get into the debate, but a lot of folks speculate, and I'm using the word speculate, that the global disease of 2020, which we can't name because of YouTube policy, was created in a lab, right? So if you have people's hyper personalized markers and genetic mapping, then wouldn't that also create a headache, because you can then create essentially a bad actor could create a lab grown virus that only affects a certain kind of people or things like that, and there have been movie plots on this, but when you actually think about it, wouldn't that also be a concern?
Yeah, I mean, I suppose that's true, and there are issues nowadays with what we call PHI, protected health information. HIPAA, we call it in the U.S., Health Information Privacy Act, and yeah, I mean, sure. Whenever you have data, then there becomes the ethical dilemma of being able to protect it. And as these data stores get bigger and bigger, maybe they're more vulnerable to attacks and theft, if you will. And sure, I think there are probably some bad things that can come out of it. And that's true, I think, I guess that's always true with technology. There's always, I think, part of the theme has been, there are good things and bad things that can come out of it.
Absolutely. Within crypto space, there is now the debate that the best cybersecurity device is a pen and paper, because you can't hack that. So if you were to keep
Yeah,
data that
going back in time. Yeah, yeah,
uh,
right. I mean, you create these technologies, you have to think of the other, I guess, the other side of it, and how you avoid problems like that.
absolutely. Um, so let me ask a few rapid fire questions to you now.
Okay.
Um, do you think metaverse and Web3 as a whole um, would change medicine as we know it right now? And if you have any specific examples that you have.
Yes, I do. I mean, I think it's already starting to change the field of medicine, and we talked about it a lot during this interview with, um, education, patient treatment in the area of spine disease and other areas as well. And absolutely.
Absolutely. There has been a debate as a non-American citizen, looking from outside, there is a debate that access to quality healthcare in US is not equally distributed. Do you think that is true?
Oh, I mean, this is again kind of it's a heated debate, I think, political debate. I mean, I guess in some ways it's true, in some ways it's not true. You know, uh, I work at Johns Hopkins, and patients come in through the emergency department that have no insurance, and we take care of them, and they have access to the best healthcare in the world. And so to say that there's no access, I mean, we don't turn down patients in the health system. Now, yeah, they may not be able to go make an appointment in the outpatient setting with somebody, if they don't have health insurance, but presumably they can go online, and if they're able to do that, they can get health insurance. It may not be the Cadillac version. And I don't want to get into a political discussion, but what is intriguing to me is that our government came up with a unified health care plan, unified insurance plan, but yet our politicians don't use the plan. Now, why is that? So, I mean, this gets into a very heated political debate, but I've never turned down a patient that came through the door at Johns Hopkins. So, and that means that any patient has access to the best healthcare in the world. Um,
Absolutely.
but yeah, I mean, these are decisions that get made by our politicians who don't always have the best interests of people in mind and have their own
Absolutely.
agendas. So,
That brings me to my next question. Do you think Web3 and Metaverse can address that? And how?
yeah, it's a tough question. It can do it if it ultimately results in a. So first, we're going to have to. It's going to cost more money to develop these things. But then, when if if it becomes more universal and potentially more efficient, then perhaps it could help drive the cost of medicine down. And if that happens, then it'll make it um, more accessible, I think.
Right. Let me then sort of throw off an idea, right? Because within the Web3 space in Metaverse, we see a lot of play to earn or move to earn. And essentially you play a game to earn cryptos, or you move in healthcare, you walk and you earn tokens, which Stepan is there, is one of the Metaverse companies that is doing. So do you think essentially doing something to earn a medical insurance is something the Web3 could do? Perhaps you do 10 Instacart deliveries a month, and that pays towards your health insurance, for example. And I'm just throwing off some ideas because
Yeah.
the issue is that the medical insurance system is not there, right? And that is why the medical system is broken. So if you want to address that, essentially you want everyone to be insured. And if you want everyone to be insured, then essentially the metaverse and Web3 industry could sort of create play to earn your insurance or something like that.
Yeah, I mean, it's getting into a space that I would say I'm not an expert in. I the I guess my personal thought is that the issue with insurance is that or I guess with healthcare is that it is very expensive, and there has to be a way to pay for it, and I think it's developing creative ways to pay for it and then allow everybody to benefit. And that's a tough solution. I'm not sure. I'm not being familiar with the kind of cryptocurrency world and that kind of thing. I'm not sure if that would be something that could be
Absolutely.
devised to pay for it. But that's
Yep,
we'll have to see.
absolutely. So there's this great debate in UK um, about NHS, right? Everyone knows about NHS. NHS is paid for by the government,
Right.
and more so, the politicians want it to be more like a US system where it's paid for by the insurance. So, at the behest of um, triggering a lot of people, I must ask you the question: as a professional in the industry, what do you think is a better system? A system where
Yeah.
you have something like an NHS where the government pays for it, or an
Yeah.
insurance-based
Well, I
system?
mean, look, again, you're getting into these powder keg debates here, and I have my own opinions, and may or may not be opinions of people watching this interview or not, but I'll give you a couple of thoughts. The insurance industry is one of the wealthiest industries in the world. So when we talk about, you know, the insurance companies they're never in trouble. Okay. So that's one thing to think about. The other thing to think about is this is the whole debate between the socialized healthcare system and a private healthcare system. Um, in countries that have the socialized healthcare system, the taxes are very high. Countries like the UK, Canada, maybe are examples. I can tell you, citizens there that are working pay, maybe 50% of their wages goes to the government. The US is a private system. I don't send 50% of my wages to the government. I send a lot of my wages to the government. I can tell you that the people that can afford healthcare, a lot of times either are able to step in at the front of the line, or some of them will come to a private system like the US. So yeah, I mean, these are really heated political debates. But I will tell you, in places like the UK and Canada, if you have sometimes a simple medical problem, you can wait a lot longer to have it treated compared to if you have the ability to have private healthcare insurance, let's say in the US, where you don't wait as long to have a similar problem treated. The
Right.
lines are longer, but I guess everybody gets treated. So, I mean, these are really tough kind of ethical, political debates.
Is there a balance where both of them can coexist and sort of for more non-elective surgeries, you have a universal coverage. But for instance, if you have something, say with your tooth, if you have a dental need, then you can go to private space. Or if you have something which is not as serious, then you can go to a private practitioner. And do you think they can coexist at the same time?
Yeah, I mean, I think that, in some ways, there's some of that in the US. As I mentioned, but the problem is it's when it becomes an emergency that everybody gets healthcare here. So they, like I said, anybody can go to an emergency room, but then it's usually, they've waited too long or it's gotten too far beyond where they, may have been able to prevent something, I guess. There's probably a way to make it coexist, but I'm not sure exactly how to do that.
Absolutely. If I had to ask you to pick anything that you could solve with um, Web3 technology in terms of healthcare, what would that be?
I mean, I think that you're not going to solve all the problems of healthcare. It's There are always going to be issues. I mean, you know, as far as I know, there's nobody that's been able to become immortal yet. Um, so, um, what problem would I want to solve with Web3 or technology? I mean, I guess the one that sort of, I guess, pulls at my heartstrings the most is cancer. We see a lot of patients that suffer from cancer, and I think that is one that will benefit from technologies in the future, and it's going to get a lot better. But that would be my thought.
Absolutely. Okay. So Dr. Witham, let me ask you a final question. How do you perceive the future as it relates to medicine with Web3 and Metaverse and AR technology?
Yeah, I mean, I think it's here to stay, and I think that we're moving into some really exciting times where this interplay between augmented reality, virtual reality, the metaverse, if you will, is going to take a play a larger and larger role in medical care. And it may not happen rapidly, but I think slowly over time there are going to be advances made that are going to improve the health system and healthcare through these technologies.
Absolutely. Well, thank you, Dr. Witham, for this great interview. This was episode 9 of Reading Between the Lines with Tam the Man. I have Dr. Witham with me from Johns Hopkins University, Professor of Neuroscience. It was a pleasure talking to you, sir.
Thank you very much.
If you like the video, please hit the like button. If you think what's being discussed is nice and you'd like to join the discussion, please comment below. And if you'd like to stay updated, please subscribe to our channel and hit the bell icon. Thank you.